Hello, my name is Mitch Miller. I'm sitting here in my dad's living room, right next to his background. Um, I'm just uploading this video. I'm going to be uploading some videos from time to time in regards to topics related to mental health and spirituality and things that I have expertise in and the work that I like to do. Uh, So today what I want to do is I want to talk a little bit about trauma because it's something I feel like I know a little bit about, and I feel like I have something to offer that people might not otherwise know about trauma. I'm going to explain trauma the way that I explain it to my clients, and explain some of the treatments that work, and I'm going to do that as quickly as I can. So what trauma is, I like to compare it to blindness or deafness. What blindness is to sight and deafness is to your hearing, trauma is to your sympathetic nervous system. If you see a really bright flash, a really bright light, you have a disorder of your vision. If you hear a really loud sound, your eardrums get overactivated, you damage your hearing. The same thing happens with your central nervous system. If you overactivate the sympathetic nervous system, and the sympathetic nervous system is what's in charge of fight, flight, or freeze response. If you felt it, you would know what I'm talking about. If you haven't felt that, then congratulations, you've had a pretty peaceable life, and you're doing pretty well. But the fight, flight, or freeze response, if you overactivate that, in the same way that when you get a disorder of your sight, when you overactivate your vision, or a disorder of your hearing, when you overactivate your hearing, um, you have damage, you have a disorder, and it can be long term, just like blindness and deafness can be long term. And the difference is with blindness, you lose your sight, and deafness, you lose your hearing. With trauma, you actually don't lose your ability to feel trauma. Instead, it just kind of is always there. It's almost like if you see a bright flash and it's just like stuck in your vision for forever, or hearing that really loud noise just forever, or at least until you're treated for it. It can cause changes in the brain that last a very long time. Now, the good thing about trauma is the treatments for trauma work. They're among the best researched treatments of anything that psychotherapy can offer. Trauma is one of the best things that psychotherapists are good at treating because it's so heavily researched, and the models and paradigms we have for understanding it go way, way, way back, all the way to Ian Pavlov and his dog experiments and stuff like this. So it's very well studied. Um, and there's a few treatments that are really shown to work for trauma. The top three that I kind of point to are prolonged exposure, which is the most well researched, EMDR, which is a close second, and then after that would be trauma focused cognitive behavioral therapy. Um, what they all have in common is basically the idea of emotional processing. And this is how I like to explain emotional processing in relation to trauma. So we all have to clean out our closet from time to time. We all have to brush our teeth. There's just certain things that we all have to do for basic hygiene. Um, and so I like to compare it. I used to like to go with the closet analogy. Every now and then we have to clean out our closet. Otherwise, it gets filled with junk. But if we go a really, really long time without cleaning our closet, it starts to get really, really messy. With trauma, it's like having 5 or 10 or maybe 20 years worth of stuff that would normally accumulate in your closet without cleaning it, all thrown into that closet all at once. And it's so much stuff, so much junk, so much trash, so much just accumulated, just whatever, that your body cannot possibly process it all at once, and you can't clean it out with your normal spring cleaning. You have to go really, really down to the grindstone, nose to the grindstone for a prolonged period of time to go through that mess and organize all of it and find out what is this stuff that I have in my closet and what do I do with it. It's the same thing. We all experience daily anxieties. We all experience daily fears. And sometimes those fears are a little bit more than others. Sometimes they're a little bit less than others. And we're able to sort of process it. We might need to talk to people a little bit. We might need to stop and reflect on what happened to us. But with PTSD, it's like you've experienced something that's so strong that your body can't possibly process it fast enough for you to be able to maintain your normal lifestyle and just pick up and move on. And so you have this closet full of junk, full of just bad memories, shame, guilt, remorse, fear, horror, shock that you can't possibly make sense of on your own at a normal rate. And what happens with that closet is over time, that junk, it wants to spill out of the closet. It's so overflowing that the closet door just wants to jack open and stuff wants to spill out. So what you do is you slam the door shut on that closet to try and keep it all in there. And you may even lock the door shut. But over time, the mess is still in there and the junk is still in there. You might try to avoid that closet as much as you can, but the stuff is still there. And the longer you wait, it starts to stink. You might maybe smell dirty clothes, maybe some rotten food that you have left over, or whatever that you have stuffed away in that closet. And so you might be avoiding that closet all you want to, but the rest of your house is starting to stink, and it's starting to create problems for the whole rest of your home. And you might not want to go looking in that closet. And you might do everything in your power to avoid looking in that closet and dealing with what's inside that closet. And that's what it's like with PTSD. You have all of that junk piled in that closet, and you don't want to look at it. Like the even thought of looking at it might not cross your mind unless someone forces you. Same with that closet. It might not cross your mind to even look at that closet unless someone gives you a consequence and tells you that you have to clean it or else. And so what the treatments for trauma basically do is they force you to, the therapist, this is where their therapist really comes in handy, is sort of like your personal trainer. They're your cheerleader and your accountability person, and they hold you by the hand and they sort of force you, but also help you go through that closet, looking at all of the different things that you have accumulated, all the junk there, sorting out what's this thing. Is this recyclable? Or is this trash? Or is this something I take to the thrift store to donate? Or what is this stuff? What do I do with it all? What's a traumatic memory? What's a shameful memory? What's a fear that I have? What's an insecurity that I have related to the trauma that you would never possibly be able to do on your own because you would just go back to the normal thing, avoiding the closet, avoiding the mess. And that's what emotional processing is. It's a sustained effort at looking at all of the trauma that you have experienced, whatever it was, that horrible thing that happened to you, or even maybe sometimes the horrible thing that you did to someone that you just can't get over. It forces you to look at it and look at all of the feelings that you experienced, all of the different emotions that you experienced, all of the different beliefs that you've made about yourself and the world from that experience. Oftentimes when something really awful, for instance, someone experiences a trauma, something really awful happens to them. They're abused in some way. They have no way of making sense of it. And so they come up with these false beliefs that this terrible thing that happened to them is their fault. It's the only way they have of making sense of this terrible thing that happened to them. And what a trauma treatment in that situation would do is it forces you to look hard enough at what actually happened and examine the evidence for and against the idea that it was your fault. And very often it ends up coming out much more complex than that. It's not your fault, or it might be you might be responsible in some ways, but ways that you don't really understand or couldn't possibly have understood at the time. And this is all done on a case-by-case basis and stuff, and everybody's trauma is different. But I just want you guys to understand what basically trauma treatments are. And how they work. It's like going through and cleaning your closet, doing your spring cleaning, but it's like doing a lifetime worth of spring cleaning, like 80 years worth of normal spring cleaning all at once. The trauma treatments, most of them that are really well researched, especially things like prolonged exposure, have an 80 to 90% success rate within 10 to 12 weeks. There's lots of research out there. If you are interested in this, please go and look up Google Scholar or whatever, YouTube or whatever, but it's very well researched. EMDR, eye movement desensitization and reprocessing, is another one that's really quite good. So is trauma-focused cognitive behavioral therapy. Basically, the common denominator to all of them is this emotional processing. All trauma treatments require that. It's the way you do that. You might use a different model or method, but they all have that in common. So if you or someone you know or care about it sounds like this is something that they're struggling with, just know that there are very good treatments out there, and psychotherapists, especially ones that are trained in one of these modalities, it's one of the best things that we are at treating. We can't treat many things better than we can treat trauma. So if you or someone you care about has these problems, I highly recommend you guys get in touch with a therapist in your area who can help out. If you have any questions or comments, please leave a comment below. And thank you for watching. Bye.